Taoiseach, our health service is under enormous pressure. Healthcare staff, nurses, doctors are literally at the end of their tether trying to keep things together, and patients are suffering. And irrespective of what hospital you visit across the country, and I was in Drogheda last week, you get a clear illustration of this. Waiting lists for routine operations are spiralling out of control and have been for some years now. Waiting times are lengthening all of the time, and records targets are being breached. Despite the fact that you changed the goalposts to make them more manageable, they're actually getting worse. You undermined the National Treatment Purchase Fund, which had been working very effectively to deal with elective surgeries and routine operations before you came into office. Our emergency departments simply cannot cope. And as I said, I was in Drogheda last week, and just talking to the people around there and in the hospital, outside of the hospital, it's the #1 topic of conversation. Waiting times for minor operations and TC scans are the worst in Europe now, and the waiting times for our emergency department likewise. There's 517 patients on trolleys in emergency departments today. Operations are being cancelled in these hospitals as a result. You can go to the Mater, Beaumont, Cork, you name it, they're under enormous pressure. But most damning of all, Taoiseach, is that you and the Minister deliberately left the hospitals of this country short at least €100 million in the health service plan. This is acknowledged by the HSE on page 90 of the 216 service plan, when it says that there is a funding shortfall of 100 million. It had been 150. They do cause something sort of cash management, shaves off 50 on a once-off basis. That leaves 100 million of a shortfall. And basically he uses the chilling phrase that one of the options which it can consider includes aligning activity levels to the funding. That means cuts, Taoiseach, in terms of capacity in our acute hospitals for 2016. It means less operations. It means more overcrowding in ED departments. It means less discharges, and so on. It is incredible, Taoiseach, that you and the Minister would have approved of this plan, knowing in advance that it has left the hospital short of €100 million. And the question I want to put to you, Taoiseach, is why did you deliberately approve this plan, knowing that at a minimum it leaves our hospitals short of 100 million for 2016?
Thank you. Taoiseach.
Well, Deputy Martin, thank you for your question. You make the case actually as to why it's critical that we be able to continue to grow the economy to deal with all of these issues. There's 13.6 billion being allocated for health this year. We have no intention of going back to a situation where endless money was thrown at a health system without reform and without effective spend in respect of both the taxpayer, but particularly here in respect of the patient, to get the very best outcome for them. I've said on many occasions, it's not a satisfactory position in a number of areas that you have elderly people waiting on trolleys for a very long time, or that incidents arise in overcrowded hospitals that shouldn't arise. And that's all the more reason why you have to look at the impact of the spend that you have and how you can increase capacity in an effective way to deal with patients. That's why, while capacity is up by 5% this year, so too are the visits and calls to accident and emergency units. You're aware there's 1,000 beds were taken out of the system, 750 more nurses employed, 300 consultants since 2011 and doctors, and an increase of 800 million spend this year. Just noticing, talking to the Minister this morning, actually many of these patients are now increasing in numbers of both adults and children presenting with flu-like symptoms. And the Health Protection Surveillance Centre has reported, for your information, Deputy, that influenza-like illness rates for week 2 of 2016 are equivalent to rates reported in mid-February last year, and influenza is obviously expected to circulate for a number of weeks But I make the point that there are 250,000 unused vaccines at the moment. So people who are over 65 or who are vulnerable, who work in the health service, should avail of the opportunity to get a flu jab. You may shake your head if you think it's funny, and go to their local pharmacist or their local GP in order to have that protection made available to them. Obviously, there's been an increase in the number of attendances of over 10% by people who are over 65 years. I've also pointed out to you on the last occasion you raised this, that in December 2014, the Minister for Health then convened the Emergency Department Task Force to ensure that where overcrowding began to occur in accident and emergency units, that it would be addressed in a proper, integrated and system-wide way by the hospital groups dealing with the issue in different hospitals. In April 2015, the HSE published the ED Task Force Action Plan with a range of actions that were time-defined, like getting the best out of the space available in hospitals and community capacities, and developing internal extra capability and processes to deal with these. And an additional 117 million account Corla was allocated for that. As Deputy Martin well knows, without effective reform, you can always say that there's never enough money. Now, you know the process that applies here. When the budget is struck and agreed by the Cabinet, obviously the HSE submit their programme to the Minister of the day. The Minister has 21 days to respond to that and either accepts it or makes amendments to it. And naturally, the HSE, in addressing the scale of the challenges, will always look for the maximum amount that they can get. As I said to you, 13.6 billion allocated this year, 800 million more than last year. Capacity up by 5%, but these increased attendances obviously create pressures in accident and emergency units. It goes back to the point, Deputy, that in order to deal with these in a longer term way, you've got to look at the community, the primary care system and the capacity in hospitals, including the employment of medical personnel, consultants, doctors, nurses and other medical personnel down along the line. And obviously you've got to have the resources to be able to meet that.
Taoiseach, you have great difficulty in answering the question you were asked. And the simple question I asked you is, why did you and the Minister and the Cabinet approve of a plan that leaves our acute hospitals short by €100 million? Because on page 90 and 91 of the Health Service Plan, it lays it out very clearly. For example, about the impact of demographics on hospitals. Demand for acute hospital services continues to increase. Demographic changes, population increased by 1% in 2016, up to 32,000 people. The over 65 age group expected to increase by 3.1%, 19,400 people. This is setting the scene, Taoiseach, for its revelation then that they're 100 million short. A 100 million shortfall before it even starts, Taoiseach. And then it outlines the implications of that on page 91. Providing inpatient services at 215 levels. Inpatient activity at 215 levels. This is now at the start of 216. This means real trouble ahead for hospitals, Taoiseach, in 216. Real trouble ahead. No supplementary estimate in accordance with EU rules. You had to bring 666 million in at the death of last year to cover a funding shortfall. We had 3 fraudulent budgets on health for 3 years. You now deliberately approve a budget that's 100 million short for acute hospitals. That will mean more overcrowding in our hospitals in 2016. It will mean longer waiting times and higher waiting lists.
Thank you.
Because, Taoiseach, you're not facing up to the reality that you are consistently underfunding health. And you can't really come in here and talk about the need for reform, because you promised reform for 5 years called universal health insurance.
Thank you.
And at the 11th hour, you ditched it. And that's why the 5-point plan has become a 3-step plan, because the Dutch model has been dropped unceremoniously from your platform, and you're afraid even to talk about health now out there.
Sorry,
all people will hear now for the next while is strong economy, Taoiseach. Taoiseach, I think there's no onus on the patients and on the people to tell the truth. Now, the Health Service fairly candidly have laid it out here in the Health Service Plan. That was presented to you, Taoiseach, and I just want to know why you decided to approve of that knowing that it leaves the health service short, or the hospitals, 100 million? Can you give me a precise, specific answer to that question? Why did you decide to leave it 100 million euros short at the start of the year, knowing that that's going to cause incredible problems for 2016?
Taoiseach.
Too good at the old sums.
Well, Deputy Martin is well aware from his experience in this department himself, and as having served as a member of government. In this case this year, 800 million extra was signed off for by the government to the HSE and the Department of Health, and responsibility comes back into the Department of Health for that vote. So 800 million extra was put in there, and the point is that the HSE, in having more effective management, would be expected to be able to deal with that. Obviously, the issues are that there are always improvements that have been made in that money. Clearly, the hospital groups were established, which I think is an important move towards having trusts which will look at the groups of hospitals and what they can specialise in future. There are 46 more primary care centres than in 2011, which are very valuable in having people not required to go to hospital for minor injuries. Families have GP access for under 6s and over 70s, and the next step is for under 12s. Since 2011, 300 additional consultants in there. Since January of last year, 750 more nurses, including 250 NCHDs. The mental health funding has been tripled. Published a suicide prevention strategy to reduce suicide, please God, by 10% by 2020. And stabilise the private health insurance market that was facing collapse in 2011 and 2012.
Thank you.
Now, I just make this final point to you. You know, I wrote this down, I remember, and I revised it again for you. Back in 2004, in respect of A&E overcrowding, you said yourself, I think it's going to need sustained investment on the nursing home side. It also requires the development of home care packages. Because of the funding constraints of the last 3 years, we haven't really been in a position to develop such a programme. Now, 2004 was a boom time where the same old way, fire money at it and hope it works. You see, Deputy Martin, giving 800 million without reform is not any good. You've got to have a developing economy and, in a planned way, deal with these structures. Community, home packages, and where absolutely necessary then to deal effectively and in the interest of the patients by employing medical personnel, nurses, doctors, consultants, and having the capacity to deal with that.